So this applies to today's community spotlight, today's professional education, as well as anything that we have done in the past that's been recorded and lives on our website. So our disclaimer is this content is provided for general informational purposes only and is not to be considered legal, financial, or health advice. Please consult with your legal, financial, healthcare, or other service providers before taking action based on information shared today. Our community spotlight this morning is Adrian Cavener, the Executive Director for the Alzheimer's Association Greater Idaho Chapter. So I am going to turn it over to Adrian to share information with us about the wonderful work that she and her team and volunteers and members of the community do.
Well, the vision of the Alzheimer's Association is a world without Alzheimer's and all other dementia. And I am very, very pleased and honored to be a part of this organization. I think that there is a lot of every day, and I'm sure that you guys do this too and learn, every day we hear about the heartache that comes with dementia and the trials that come with dementia and how hard it is. And all of those things are absolutely true, right? But we really see a time where treatments are available that delay the onset of symptomology. And a big part of what we do is that research. So one of the things that we do is global research. So the Alzheimer's Association is the largest private funder of Alzheimer's research in the world, third only to the US and Chinese government, respectively. And how many of you, again, by the raise hand function, have heard of a drug called aducanumab? When I told my husband this, he's like, that sounds like gibberish. That sounds like something that your toddler would say, aducanumab. And I don't know who is in charge of naming these drugs. But it is in special, yeah, right? It is in a special consideration by the FDA right now. And it would be, right now, there's only 4 drugs on the market to treat Alzheimer's. And this would be, and all 4 of those treat the symptom, so of Alzheimer's and dementia. Right? Aducanumab, if approved, would be the only drug on the market that would treat the underlying causes of Alzheimer's and dementia, which we all know are the plaques and tangles in the brain. So the way that you can think about this is we've been treating the runny nose, right? So far. And this would be the first drug that would be the antibiotic, or the equivalent of an antibiotic that would treat the actual bacteria. So this is really, really exciting news. I've been very, very excited about where research is. And if you let me, I would spend the entire time just talking about the research and where it's headed. One thing that really excites me right now is we are about 2 years away from a blood biomarker test. Right now, there's only 3 ways that we can confirm that somebody has Alzheimer's, and that's through a cognitive test, which is where most people get diagnosed, a PET scan, which is very expensive, or a lumbar puncture, which is very expensive and extremely invasive, right? So the only way that we can screen population levels are through cognitive tests. Imagine a day. So the only time that we can find Alzheimer's is in dementia, right? And so it's like we can only find cancer in stage 4 and then say, well, see, cancer is unsurvivable, right? That's where we're at right now. Imagine a day where we could find, because we know the plaques and tangles happen in the brain as soon as your 40s and 50s, right? So imagine a day where you go in for your annual physical, you get a blood draw, and they test your triglycerides and your cholesterol and Alzheimer's, and the test for Alzheimer's. And then we can treat it, and maybe we can keep you there for a number of years, right? So that you have Alzheimer's, but we delay the onset of symptomology, right? Like that's kind of where the science is headed, and that's really, really exciting for me. The other thing that the Alzheimer's Association does, and what kind of people know us for, is for our care and support. So again, research is solving the problem in the future. Care and support is really helping individuals and their families now. So we do this through a number of ways. We have a 1-800 number. I call it the 1-800 number that actually helps people. This is on the other end of this line, our clinical master's level help. That walks people through the diagnosis, they give referrals, etc. It is 24/7. 365 days a year. And so the way that I also like to tell this is, if you are somebody who is a caregiver and your husband has just mistaken your closet for the bathroom for the third time today, and you just can't handle it at 3 a.m., you can call the 1-800 number. Also, all services are given in the language of choice. So we have Spanish speakers and have services for all languages that are spoken. We also have a number of support groups that are spread out of throughout the state. One of the kind of interesting benefits, if you can call COVID having benefits, but one of the benefits that we've had is that Stacy actually has people from all over the state in her support group. And so we've been able to reach, again, simply not in the extent that we would like, but we've been able to reach kind of these more rural parts of the state that didn't have access to our services before. We also have community education, and you're going to get a taste of that today. And then we also have a care navigation program. So we have a hired somebody with a social work background that takes people by the hand and their loved one and walks them through the diagnosis. So as you guys know, Alzheimer's diagnosis can feel like a tsunami of choices, and we help people walk through that. The next thing that we do is advocacy. I'm not going to steal Lisa's thunder. She's my director of public policy, and she's going to talk to you a little bit about what we've been doing at the federal and state level, more over on the state level, because that's kind of the exciting thing. Our Senate finally sine-died last night, so we're getting towards the end of legislative session this year. But we do both state and federal advocacy. I think that it's one of the big things that we did was the Napa Act, which increased federal funding through the NIH for Alzheimer's and dementia. And really, we've seen just an exponential increase in funding for Alzheimer's because of that. And that act was 10 years old, and we're now up at 2.3 billion, Lisa? Eek? $2.3 billion for research through the NIH because of the direct advocacy work of the Alzheimer's Association. So again, that's changing the system in which people live. And then we also do fundraising here at the Alzheimer's Association. I don't know if you've heard, but we have a number of things that we do. Right now, we're recruiting for what we call the longest day. The longest day is branded around the summer solstice, and it's basically, what do you like to do? Do that for the Alzheimer's Association. It's the nation's largest third-party fundraiser. So if you like to bowl for the Alzheimer's Association. You like to knit, you like to hike, you like to fish. Like, what is the thing that you are passionate about? Do it for the Alzheimer's Association. We also have our Walk to End Alzheimer's, which is what most people know us about. That's going to be in the Treasure Valley on October 2nd. And what I really love about this is, again, I don't have to tell this crowd, but Alzheimer's can be very stigmatizing and very isolating. And this is the time that we put a stake in the ground and we bring people kind of out of the shadows. And it's the one time where you can really see, because of these silly flowers that we give people, how that you are part of a larger community that is all being affected by Alzheimer's and dementia. And that is, I've worked nonprofit for a very, very long time. And if you have not made it out, the Walk to End Alzheimer's, I'm not asking you to raise a single dollar, although that would be helpful. But if you would just come out and see what the walk is on October 2nd, you will not be disappointed. And then the last thing that we are launching in the Treasure Valley is something called Memories in the Making. I'm really, really excited about it. It is a way to engage early and mid-stage Alzheimer's and dementia patients through watercolor. And so it's a way that we can use art to engage, to jog memories, and sometimes it's just as much of a color or an inspiration. And then we show them, for later stage individuals, we show them their piece of art maybe 4 weeks later. So imagine seeing your own art without the filter of self-deprecation or self-criticism. It's really quite beautiful, sometimes funny. But we really use that as a way to engage those with Alzheimer's. And then we do a community exhibition where we show those pieces of art, and then we go out and commission professional artists to do a companion piece with that. And so you have the original artwork, the piece of artwork that is inspired by that original piece. And then it's a way for the community to talk about Alzheimer's and dementia in a way that they haven't before, and in a way to engage them. So that will be in spring of 2022, and we're really excited about that. We're going to launch our first class of artists early June. So we are getting the volunteers up and running and trained for that.